Good afternoon, GERO 504 students. My name is Andrea Brito, and I'll be covering Medicare, the federal insurance system. Why Medicare? With the aging population and the baby boomers turning 65 years by 2030, as aging service management professionals, it is important for us to know its history, its in and outs, as we will be serving as their advocates. Prior to Medicare, the only form of healthcare insurance was through private health insurance, which was only available to the working middle class. Our society saw a need, as a number of individuals were being left out, one of them being the elderly population. In addition to this, healthcare was becoming much more expensive, and it was foreseen that the elderly population would be unavailable to afford healthcare services. Therefore, in 1957, Amy Foreign suggested hospital and nursing care as part of the Social Security benefits. However, this interfered with the physician and patient relationship. Following, in 1960, Medicare Assistance Act came into play. This was a federal grant set in for the states, which allowed states to cover low-income and elderly that didn't previously qualify for any type of health insurance. However, this system was short-lived, as not all the states implemented it. Come 1965, Congress passed the Medicare Title 18 of the Social Security Act. This was where Medicare Part A and Part B came into existence. Medicare is the federally administered health insurance program, which is run through the U.S. Department of Health and Human Services. Who exactly is that qualifies are those individuals that are 65 years of age and older, along with their spouses, individuals that are disabled and are currently receiving Social Security, or those that are diagnosed with end-stage renal disease. What are the various programs within the Medicare system? They include Part A, which is the coverage of inpatient services, such as hospital stays, skilled nursing facility stays, home health agencies, along with hospice. Part B is optional, and it's the supplemental medical insurance, which covers physician coverage along with outpatient services. Part C is only available to those participants who are currently enrolled in coverage of Part A and Part B. Part C is actually covered through private plans. And last but not least, Part D is a coverage for medication. So what's the extent of Medicare's coverage? Under Part A, we have inpatient, skilled nursing, home health care, and hospice. With inpatient, the initial 90 days are covered per benefit period. And the benefit period consists of when the patient is initially admitted into the hospital and ends when the patient no longer needs any hospitalization or skilled nursing facilities services for 60 consecutive days. In addition to the 90 days per benefit period, the patient has a one life 60-day extension. So once the 90 days are complete, they get to use an additional 60 days once. Once those are completely over and up and used, they will not have that additional 60 for their next visit. If, per se, they use the 90 days in addition to the 60 days, after the 151st day, the patient will be completely financially responsible for any healthcare expenditures beyond that point. In skilled nursing facilities, a bit different, as it is required for it to qualify, the patient must have been hospitalized for 3 consecutive days and be admitted into the skilled nursing home within 30 days of discharge. The first 20 days are fully covered, but from days 21 to days 100, there is a co-payment that's required. Home health care, on the other hand, is required. It's covered only if there's a 3-day hospitalization or skilled nursing facility discharge. Things covered under the home health care include physical therapy, skilled nursing, home health agencies, rehab, durable medical equipment, social services, and other medical supplies. And the last section would be hospice, which covers health services, more of the palliative end-of-life care for those who are diagnosed with life expectancies of 6 months or less. And lastly, Part B, which covers outpatient services, including physician services, ER visits, outpatient surgery, labs, physical therapy, occupational therapy, and speech therapy. However, this does not include any dental visits, hearing aids, or eyeglasses. Medicare represents 13% of the federal budget and 22% of the national health expenditures. It is financed through the United States Treasury through the Hospital Insurance Fund or the Supplemental Health Insurance Fund. With the Hospital Insurance Fund, the collection is made through payroll taxes deductions, which is equal to 2.9% for self-employed, or it's divided by 2 for an equivalent of 1.45% per employee and employer. For the Supplemental Health Insurance Fund, on the other hand, it is based on a monthly premium, which covers 25% of the total expenditures consumed by the elderly population. This premium is adjusted annually to reflect the estimated cost of the health care expenditures for the upcoming year. Prospective payment systems are used to determine the reimbursement amount. In hospital, DRGs, or diagnosis-related groups, are used for the reimbursement payments, which are based on groups of services for patient required according to his or her diagnosis. A hospital may receive more or less an amount of payment, which is may equal to the cost of healthcare expenditures. If it's more, then the hospital makes a profit. If less, then the hospital assumes the losses. For skilled nursing facility, resource utilization groups or RUGs are used, in which the MDS is used to assess the patient in terms of its clinical, functional, and psychosocial needs. This is then transferred into the classification, which is used one out of the 66 RUG categories according to the care needed by the patient. The RUG classification is used by Medicare to process the per day rate per patient. And lastly, these claims are processed through 2 different non-governmental organizations: the Medicare intermediaries, which process institutional service claims, or the Medicare carriers, which process physician and medical suppliers. And other responsibilities of these 2 non-governmental organizations, aside from determining costs and reimbursement rates, include making the actual payments, maintaining records, protecting the program against fraud, abuse, and overuse, and lastly, assisting providers and beneficiaries with any questions or concerns. Thank you. That's all.